Bismillahirrahmanirrahim and Assalamu alaikum. Welcome to my channel. Today I will discuss the most important topic of special education, that is sensory integration for special need child. You have to understand the sensory integration and its importance. Sensory integration is a term that has been used to describe process in the brain that allow us to take information we receive from our five senses, organize it, respond appropriately. The term refers to the processing, integration, and organization of sensory information from the body and the environment. This means how we experience, interpret, and react to or ignore information coming from our senses. Sensory integration is important in all the things that we need to do on daily basis, such as getting dressed, eating, moving around, socializing, learning, and working. This is all about sensory integration. If your child is special, he has sensory problems. Mostly it is related to ASD, autism spectrum disorder. These kids have sensory issues. That's the reason they become hypoactive or sometimes hyperactive. For example, picture yourself at a cottage. You are standing on the dock about a climb into corn. You put full down on the canoe as you begin to step in the canoe. Automatically you adjust your body to keep yourself balanced and slowly sit down, placing yourself in the middle east of the sea. This is sensory integration. You have the sense to how to control your body, how to save yourself from the danger. Our bodies and the environment send our brain information through our senses. We process and organize the information so that we feel comfortable and secure. We are then able to respond appropriately at a particular situation and environmental demands. This is sensory integration, and this is missing in the children with special needs. This is missing in the children especially with autism. This is called sensory integration. Next, we will talk about sensory integration disorder, SID, sensory integration, or SPD. SPD is a neurological disorder that results from the brain inability to integrate certain information received from the body's sensory system. Individuals with SID, sensory integration disorder, are unable to respond to certain sensory information in such a way that allows them to appropriately plan and organize what needs to be done. When a child has SID, sensory integration disorder, their response to sensory information often appears extreme and inappropriate in a particular situation. For example, I have seen many students with sensory integration problem, one of our student has mm, very issue with the loud voice. He become hyper when he listen the loud voice. Sensory integration, population, and comorbidity. SID is often associated with following disabilities and disorder, typically developing individuals: neuromuscular disorder, CP, autism spectrum disorder, intellectual disabilities, learning disabilities, and ADHD, attention deficit hyperactivity disorder, language impairment, behavior disorder, anxiety disorders, and depression. Factors that contribute to SID include uh, premature birth, autism and other developing disorders, and learning disabilities, delinquency and substance abuse due to learning disabilities, stress related disorders, and brain injury. And the two biggest contributing conditions are autism and ADHD, attention deficit hyperactivity disorder. Some researchers question when the SID is a disorder, then can be presented as a separate diagnosis, or if it is a simply symptom of the disorder. So, this is the comorbidity for the sensory integration disorder and ADHD and other disorder. Now we will talk about SID leading to SPD. Sensory integration disorder leading to sensory processing disorder. Learning is learning in an environment requires organization of sensory information, adaptation of that information to many situations. You can learn by the organization of things. This function can occur in four areas: limbic system, vestibular system, tactile system, proprioceptive system. So this is lead to SPD, or sensory progression disorder. Sensory processing in infants. Studies on selective attention in infants. Slow show early sensory responses and changes from the norm result in developmental disability or ASD, attention autism spectrum disorder. Two responses to stimuli, orientation and defensiveness, used as measure of efficiency of sensory processing behavior, also as foundation for social skills and communication skills. And any disruption to sensory processing abilities. For children with SID, a form of occupational therapy used and facilitating language in therapy, hyper responsiveness. Take advantage of stimuli that have caught the child's attention, build communicative interaction among the that stimulus. Hyper responsiveness or hyper responsiveness seen together accommodate co-occurring shifting sensory behaviors within your sessions. Accommodation must change based on child behavior. Sensory seeking incorporate unique child specific stimuli that might engage child and motivate better attention during your sessions. Must always consider the child's underlying sensory responsive pattern to provide successful intervention. If you are working with a child autism spectrum disorder, there must be always a sensory problem or sensory integration. In some cases, it's also related with other disorders like Down syndrome. One of my student has a sensory issue of voice. She became disturbed from the loud voice. So you have to find out the sensory problems of the child. Then you will find out the um, uh, therapies or solutions. Now we are talking about some sensory activities. These are the sensory balls that are used to activate the sensory sensation of the child. These are present in sensory room, whether you are giving therapy. These are other beans, lobia beans, and other items that are used for the sensory integration or to enhance the senses of the child. Child become very happy to see these interesting and wonderful activities when they engage for the 10 to 15 minutes they may engage, or some in some cases student may engage in only 10 minutes. These are the sand, and these are the ball, all other things present in one tub. So child has can put these things out then in. Different activities can be done by this mm, by this by this. And now the next is vestibular to rocking, sliding, jumping, swinging, bouncing, spinning. The children who have vestibular issues, so by using these vestibular tools, their problem can be reduced. Mostly children have vestibular issue with spinning, swinging. So and in few cases they have the problem with jumping. So these are the tools for the for enhancing the children activity to reduce the sensory problems. Sensory based activities, hyper responsive children, sensory corner with sensory box, many textures with weight, vibration to stimulate oral motor awareness, deep pressure touch, sand water play. These are the activities by hypo that are not responsive. So these activities are must be used for the children. Give child heavy object to carry, so their muscles be active. Or their like hyperactive means the child is sleeping like, and for these these activities are used. Sensory seeking activities, sensory corner include a weighted blanket at rest time, rush sensory play, chewing tubes, colored lights, music lights. In sensory room, you have to put bean bags, balance beam, weight ball, exercise balls, dribbling balls, joy jump, play doh, rolling pins, ball pit, gong tube. And your sensory room must be filled by the all activities. So child, because child have one activity for few uh, time, Then he will move to the next activity, traveling with sensory seekers. These are the sensory seekers, balls, cushions. These all are the sensory seekers, and these are for the sensory integration and so on. The next is toy for the tactile sensory play. Toys to improve tactile sensory. These are the balls, pinching balls with pins or 3D shapes balls. These are the flowers that are of 3D shape or 3D, and the child can make this or by using these flowers and these types of sensory cards. Their sensory uh, sensation can be improved, or they can be busy like these. They can feel these flower or these cards. The next, and these are all the kinds of different 3D shaped cards and flowers that the child can feel. And the next are the gloves, sensory. We can say these are the sensory hands. Those the children with hyposensitivity, we can use these sensory hands for this purpose. Calm down box. This consists of different items, different balls, and different things that can use to calm the students. Rainbow tactile sensory but these are also used to engage the child in different activities, and these are a lot of activities, and they by seeing these you think that these are enough. These are not enough for the child need more and more. These are other sensory bottle, and every bottle has different shapes, different objects in it, and the child can see this and you can engage the child, and these are very beneficial for the students with sensory problems, especially autistic child that have more sensory issues. If you like my video, please subscribe and share. Thank you so much. Remember me in your prayers. Allah Hafiz. Assalamu alaikum.